a varicose vein that was crossing over my left knee here, or right knee here, and the bulging was terrible, and the pain that I felt, and if I hit it at work, it was uncomfortable. And I finally, and little kids would ask me, you know, Miss Margaret, what is that? And I would tell them it's a pet snake that I own under my skin, and and I got embarrassed by that, and so I made the first step to, I needed to call, and then I saw the Allure Medical Spa commercial on TV, and that's when I said, that's it, I can't deal with this anymore.
So we're going to talk about a few terms: varicose veins, spider veins, and something called venous insufficiency. Varicose veins are veins that are bulging on the surface of your skin. They're usually twisted and bulging, and they're generally a little bit bigger. Spider veins are the little tiny ones that are like networks that looks like a spider's web, and they're tiny, and they could be blue or purple or red. And venous insufficiency is something that causes varicose veins and sometimes even causes spider veins.
I had varicose veins in both of my legs, causing me a lot of leg cramps, especially at night. And I was hoping came to Allure to remove the pain from my legs.
So let's talk about how the circulation works in the first place. When your heart beats, it's supposed to squirt the blood from your heart to your head, to your arms, to your feet. And that's your blood pressure, and that's your pulse. Now the blood's got to get back from your brain and from your arms and your legs somehow. In the case of your head, it just drains back down to your heart, and there's no valves necessary. In your legs, there's a series of one-way valves that when the calf muscle squeezes, the valves open, the blood passes through, and then it snaps shut. Okay, and that's a normal circulation. In the case of venous insufficiency, the valves aren't quite working properly. So your calf muscle pumps, squeezes the blood up, the blood goes through an open valve, and the valve's supposed to snap shut, but it doesn't, and it's actually insufficient, lets the blood go back down. So now the blood's sitting there, it's got to go somewhere, and your body tends to want to make more veins, and that's what a varicose vein is. It's from venous insufficiency, from these valves not working properly.
I had varicose veins, and my legs were becoming very fatigued. I live a very active life, I teach fitness classes, and by the end of the day, I was exhausted.
What are the symptoms of varicose veins and venous insufficiency? Well, swelling, aching, fatigue, restlessness, itching, burning. Multiple symptoms can be attributed to varicose veins. So to treat the varicose veins or get rid of the varicose veins, first we have to find the cause. So we use an ultrasound. And the ultrasound creates a three-dimensional roadmap that tells us which veins are causing the veins that you see. Typically there's veins underneath the skin that you don't even see that are causing the varicose veins, and we find those with ultrasound. The technician creates a three-dimensional roadmap with ultrasound so we can figure out how to best treat the varicose veins and eliminate them. After we do the ultrasound, we can determine how many treatments are needed, but typically more than one treatment are needed to eliminate your varicose veins. The procedure is done with very little discomfort. It's an outpatient procedure done in the office, and you return to your activities right away. You don't need to be sedated or put to sleep for it, but if you want something mild sedation, you can have it. In many cases, people are worried about getting rid of varicose veins because they've heard of someone in your family or somebody new that had painful stripping surgical procedure. Varicose veins now are treated totally without stripping. There's no surgery, no downtime, and very little discomfort.
The very first time that I came in, I had a mapping done, and then after that, it was determined that the vein could be removed. So I came in for a follow-up procedure. It was very quick and easy, and before I knew it, I was back to normal.
A common question might be, don't I need these veins? What happens when they're gone? What happens if I need them for my heart or a heart surgery? Well, varicose veins are non-functioning veins. They certainly can't be used for other surgeries, and once the varicose veins are gone, your circulation improves. After your varicose veins or spider veins are treated, the number one thing to do afterwards is wear compression stockings, and we'll measure you for them, and then do plenty of walking. There is no downtime. You can go back to your normal activities. You can go to work, play, sports, exercise, anything you want to do. But wear your stockings at least 2 days, and if you wear them a little bit longer, you actually get a little bit better result. The most common side effect treating varicose veins is that they're discolored for a few months after the procedure. It can last any amount of time, but typically 2 to 4 months, they'll look a little darker and then fade away. After completion of a varicose vein treatment, and with our follow-ups that we recommend, the varicose veins typically will never return.
I was really nervous about coming here, and because I wasn't sure what type of pain or anything like that, but I recommend it. It was pain-free. I went right back to work the next day.
It's not embarrassing to walk around in shorts during the summer, and everybody notices the vein is gone.
I said, you know, I can't thank you enough. I said, because ever since I did it, I could stand all day I'll go home and I'll work all night around the house or do whatever. By the time I go to bed at 10 or 11 o'clock at night, I don't feel anything. My legs don't hurt. Before, I thought it was just getting old or I was just working too much.